Fellow Barbadians at home and abroad, I greet you this evening from quarantine. I flew into Barbados as a result of the Prime Minister's request that I should lead our communications team, and therefore I'm at the helm this evening of this press conference. I said that I greet you from quarantine, and I know that there have been many questions about the kinds of bracelets or bands, armbands that people wear in quarantine, and therefore I'm in a position this evening to show them to you. This red band that I'm twisting around my arm is given by the Ministry of Health to indicate that you are going to a hotel or villa for your quarantine. The second white band, you probably can't pick up, is the biometric or electrical one. There's a flashing light in it, but this is the one that tracks your movement to ensure that you don't breach quarantine as part of our stepped up security measures. And then there is a third band. In this case, it's issued by the hotel. I'm at a hotel. Mine is red, and it is an indication to others that I am not supposed to be walking about property. I'm here in quarantine. So I can assure you that I have stayed in my room and kept the quarantine rules entirely. And I know that people don't normally get to see them. And I thought I would start by sharing that with you. This evening's press conference it is a press briefing as opposed to a press conference because there are no live media personnel with us this evening. And I want to explain to you that since arriving on Saturday, I've made some decisions about how we should approach these press conferences. As of tomorrow, press briefings and press conferences will be held on Tuesdays, Thursdays, and Saturdays, unless there is something new and major to report. I've not yet been issued with a telephone, but I will give my telephone number to all media houses so that in the days between a press briefing or a press conference, if there is some issue that breaks or the media wishes to get some inside scoop or to get clarification on an issue, then they are at liberty to reach out to me. It also allows me to communicate with people who have a concern and who feel that they need to have either at the international or the national level some issue clarified. And that is part of my role, to help to build public trust, to help to guide our communication so that there is certainty around what we are doing, so that the communication with the public is clear and can't be quarreled with, because there have been concerns. There has been some criticism as to the approaches, sometimes the information you get, and therefore we want to be more timely, we want to have clarity, and we want to build public trust with all stakeholders, particularly Barbadians at home and abroad who have a vested interest in protecting their health and ensuring that Barbados is the best that it can possibly be. And I want to make that clear, that our interests, the responsibility of the government is first and primarily and always to our nationals first. Equally, we have a responsibility to those who are guests and tourists. And I know there's been a lot of talk about how we're treating tourists as opposed to how visitors, nationals are being treated. And I'm going to speak to that later in the evening. Press conferences in the future will also have a structured format. We will have key issues or messages of the day, which we are going to convey to you. There will also be a template for the information that you are going to get on those who are ill in quarantine or what the numbers are looking like, so that you have some clear idea as to who they are, where they are, and the actual numbers. And I know that questions are often asked about breakdown, and we want to be able to give that to you. So I'll share that template later in the evening. The idea is to improve coordination and communication, because there's so many moving parts, so many government agencies that are working hard, playing a role to deal with the challenges that we have had over the course of the last few weeks, as systems, health systems, all over the world have become overwhelmed with the sheer numbers of people who are becoming ill from this pandemic. Coming into Barbados, I had great difficulty getting a COVID test and actually had to get a hospital administrator to approve my test for me to get out of New York and get on a plane. So there are challenges, but we know that there are also peculiar difficulties that we've had. And we are going to speak to those fully and frankly this evening, and what we are doing to address those particular challenges. So I am happy to join the team of the Ministry of Health in order to help Barbadians, and I am committed to that process, to being full and frank with you, and to ensuring that you get a quality of information on which you can have confidence, that we build trust and stakeholders amongst our national population at every level, and amongst Barbadians who are living abroad, who naturally are concerned about what is happening in the countries where their naval string is buried. And with that, I am going to have join me this evening Dr. Anton Best, Dr. Corey Ford, and the Honorable Sandhya Bradshaw, Minister of Education. And you're going to find, therefore, that the press conferences are going to be very targeted and structured in relation to the information we give. Now, I'm going to point out that journalists will be at liberty to ask any question they want. Clearly, I've just come on the ground, and therefore I didn't feel that this evening I could do a full press conference. So this is a briefing to give you critical information, because I know that the social media and the traditional media was hot over the course of the last few days, and we really want to deal with some of the issues that have come up. But tomorrow we will have a full media briefing where members of the media will be here, when I say here virtually, and asking questions as they normally do. And then we will go on to the next day for the press conference, which will be Thursday. If anything major breaks, please rest assured that we will have a press conference. We are going to bring it to you. We're going to give you the facts unvarnished so that you can have them for your own knowledge and information. And I want to pause here to say that government has a clear interest in being accurate with the information they are giving. The reason being that that is the only way that citizens can be protected and have certainty about what they're going to do. There is so much on social media that is just inaccurate, misleading, frightening, and it's just throwing people into a certain level of panic and uncertainty and a level of disquiet over what is out there. We are going to give you the facts. That is the only way we will have credibility. That is the only way trust can be built with national and international partners and stakeholders. And it is the only way that you, as Barbadians, people of all ages, from all over Barbados, can have confidence in what you are hearing, in what we are asking you to do, and in the information that we are giving. So thank you for joining me this evening. Thank you for joining us. And you can trust us to help to keep you safe. But there is also a level of personal responsibility that is required. You also have to act in ways that help to keep yourself safe. Okay. Dr. Anton Best, we're going to, I indicated that we have a little bit different format. And this evening, I am proposing to put some questions to Dr. Best about what has been happening, because the news has been, Dr. Best, I know that you're with us. There's information out there that there are hundreds, that there are thousands that there are all kinds of people delayed in quarantine without getting results. Can you please guide us through this? Can you tell us, are there lots of people who are delayed on island? There have been social media messages, criticisms in the media, traditional media, non-nationals quarreling, Barbadians quarreling. Please, can you help to give us some certainty on this? One. Two, if in fact there are tremendous delays, what is responsible for those delays? What are you doing about them? When I say you, the Ministry of Health, how are you dealing with them? And when can we expect to get relief and release? Because people are under immense stress and the country is getting a bad name. Dr. Best? And of course, you will also update us on the current numbers, I believe. I look forward to hearing you.
Thank you, Ambassador Thompson, and good evening to all persons in Barbados. Ambassador Thompson, let me be the first to welcome you in this public forum on behalf of the Ministry of Health and Wellness. We are delighted to have you as part of the team, and we look forward to the work that we're going to be doing over the next few weeks. So welcome and thank you very much. So I'll start off with a brief overview of where we are with regards to COVID-19 in Barbados. On January 10th, we conducted 819 tests and we diagnosed 6 new persons positive with COVID. That included 4 men and 2 women, and 2 of those men that were diagnosed were male inmates at the prison. And yesterday we released 10 persons from isolation. So since March of 2020, the total number of confirmed cases of COVID that we have is 884. The vast majority of those cases being males, 516 males compared to 368 females. And we've conducted just under 84,000 tests in the last 11 months. In isolation at this current point in time, we have 478 persons. We've discharged 399, and we've had 7 deaths, but thankfully, we have not had any recent deaths since May. Getting to some specifics about the clusters that we've talked about. At the prison, we've diagnosed 58 staff members, or 18% of the staff population with COVID. That's 37 men and 21 females. Out of the inmates, 22% of inmates are diagnosed as COVID positive at this current point in time. And associated with this cluster in the prison is 42 cases outside in the community. We also talked about the bus crawl, which is affiliated with the prison, and we have diagnosed 16 persons with this particular cluster. We have other clusters that we've talked about. We have the West Coast clusters, and the reason why I say clusters is because it's not one discrete cluster, it's not one large cluster, and it did not occur as a discrete event on a particular day like the bus crawl cluster. And we currently have 67 persons in those clusters. And those clusters are associated with approximately 6 places on the West Coast. We also have a South Coast cluster, which is a small cluster, but certainly 4 cases that we've linked to each other. And then we have many other small clusters that we have not fully delineated. So in summary, the daily numbers are fluctuating, but with an overall downward trend. We are optimistic that we have this massive outbreak under control, cautiously optimistic. We've conducted vigorous contact tracing efforts, and this is occupying the majority of time and effort and energy of the polyclinics, which are the backbone of our public health infrastructure. And we've made significant headway, but we need more time to be able to contact trace all the persons that we need to contact trace, to be able to isolate any new cases that we find, and then get out of this epidemic. So how did we get here? A number of factors led to this crisis that we're currently facing. We had increased tourist arrivals during the winter season, and especially ahead of the Christmas or festive season. We had increased socializing during the Christmas holidays. And we have to admit that a lot of us in Barbados dropped our guard and not doing all of the things that we were supposed to have been doing. And then, of course, with the initial outbreak of cases, we had a lot of persons panicking and going to testing facilities to be tested because they may have heard that persons that they knew or places that they went were associated with the COVID outbreak. And while we want people to come forward and get tested, we did not anticipate the numbers coming forward. So that really overwhelmed the system and put us into what I describe as a perfect storm and a situation that we are trying to get ourselves out of. We have a huge backlog at the lab and we are addressing it. How are these issues being addressed? We've implemented a comprehensive program known as SHAPE, and this comprehensive program starts at the airport from the time we have visitors arriving to the endpoint, which is the results being given out to the healthcare providers. But one of the problems that we had with SHAPE, you're going to get problems with any new application, any new system that you're implementing, IT system, you're going to get teething issues. We anticipated that. However, to complicate that, we had internet connectivity issues, which we've only just resolved with the help of the Ministry of Innovation, Science and Smart Technology just a few days ago. And we are conducting the training that is required to fully utilize this system. So we do anticipate that within the next few days, we would fully utilize SHAPE, but we will be paying close attention to any issues that arise and addressing them as they come. So the lab remains inundated with testing samples. We're implementing a new inventory system, and this is something that we're doing in collaboration with our Ministry of Tourism partners, interestingly. And this is just one key point that I need to make, that the Ministry of Health and Wellness does not have all of the solutions. And this is why partnership is of critical importance, bringing together minds, bringing together a lot of persons to help find solutions to these very complex issues that we're faced with. We've also partnered with members in the private sector. We would have talked about a categorization system that we have for samples, categories 1 through 4, and that has started in full from today. We also looked at the additional capacity that the lab needs, and this is something that we've been working on for the last few weeks, last few months, in fact. And then because of the surge in demand in services, we are adding additional human resource capacity at the lab to be able to address the backlog that we have. So let me assure all persons in Barbados that we in the Ministry of Health and Wellness at the Queen Elizabeth Hospital, the wider government, partners, volunteers are working assiduously to bring this outbreak under control. We need your understanding and cooperation and patience, and we must work together to bring this outbreak under control more effectively. So we're going to get there. Ambassador Thompson, thank you for the allowing me to give a brief introduction to answer some of the specific questions about the numbers of persons in quarantine. We have 172 persons in quarantine at our facilities.
Dr. Bass, before you go on to dealing with the numbers of in quarantine, I'm going to take my style from David Ellis, senior veteran journalist in Barbados, and say to you that you have not answered the critical question which I put to you, which is when can Barbadians and other persons, visitors, expect to see some sort of change? There has now been, the government has been saying for some days that they're having a challenge. I prefer to term it as a challenge, not a crisis. And when do you expect, based on the planning and based on what you are putting in place, would you tell us exactly what is being put in place? When do you think that we will get to see some sort of improvement? That is the key issue.
Yeah, so we expect to see improvement right away. As I said just now, we have started the categorization process where we've identified sites for Category 1. Category 1 are the priority samples that we will be receiving, and those samples will be prioritized, and the results for those samples will be out within 24 hours of receipt in the lab. So all of these things are coming together to improve this situation that we've found ourselves in, and certainly by tomorrow we will start to make headway. Will everything be resolved right away? No. but we are getting there.
Thank you. Thanks very much. If you would be kind enough then to go on to giving us some sense of the numbers, you had started to make some other points.
So, yeah, so I would have mentioned that we have 172 persons in quarantine at our facilities. We have, according to the Ministry of Tourism colleagues, we have approximately 400 tourists that are still in a situation where they do not have the results. And this is something that and these are results to end quarantine. This is something that we're working on assiduously as well.
Just want to explore the issue of the backlog a little more because that has been the concern of that we've been hearing most about from visitors and from nationals. When you say that you expect to see improvement, are you saying that you expect to see improvement in the response for new tests coming in? Are you saying that you expect to see improvement in the backlog of which people have been complaining? We've heard stories of people rescheduling weddings. We've heard stories of people missing flights. Tell us a little bit about the backlog. That is the key issue on which the public is focused.
So the backlog that we're referring to is a backlog of samples that are still at the lab that are yet to be processed. So all of the systems that I would have talked about before are contributing to decreasing that backlog starting from today. We are hoping and aiming for to be on top of the samples that are now coming into the lab, as well as addressing the backlog of samples that we currently have. This is what we're working towards, and we will update the persons, we will update all of you as we make progress where this is concerned.
Can I ask then if we can expect to have some status update on whether these measures are or are not working at tomorrow evening's press conference?
Yes, we will give a status update where that is concerned.
Thank you very much, Dr. Best. I don't mean to appear to be going after you, but really the public does have an interest. And if you can feel the angst and the deep concern that nationals, non-nationals, and those who are visiting, and visitors include Barbadians as well, are feeling when you go through the social media, and some of the stories are heart-wrenching. Thank you. Speaking of heart-wrenching, I want to say to those of you who are here, who have been delayed here, who came because you wanted to have a good holiday, who came because you wanted to see Auntie May, who is ailing, and you wanted to spend some time with her, and you now have to get back to work, having not left quarantine. I want to speak to the family whose story I read on social media, to the man who was stuck in quarantine, even though he came for his father's funeral. He never got to his father's grave. Sir, I want to apologize to you. The government is doing everything that it can, given the numbers, given what is an international trend, given the fact that we've had these simultaneous breakouts that we could not have anticipated, given the fact that there have been breakdowns of equipment that we could not have anticipated. There is nothing, I think, that will make you feel better. But please understand that you have the sympathy and the apology of the government of Barbados. There is nothing that will pay you for the pain you suffered by not being at your father's graveside. I rushed to Barbados earlier this year to be at my mother's side when I was told that she was dying. So I do have an idea what you are going through, sir. And I want to tell your family that we are truly sorry. We are sorry for what you have suffered. And I want to say to everybody in quarantine this evening, those of you who had to be back at work, those of you who somebody is looking after your children while you sneaked down for a few days off or a break, those of you who came to see our island for the first time, all of the Barbadians who were hoping to spend time with relatives and friends just after the festive season to start their new year off on another note. There is no way. We are accustomed to excellence. We deliver a superior tourism product. We deliver a superior visitor experience. And our visitor experience includes those visitors who are Barbadian, who are coming from outside. There is no way that the government would have deliberately mangled this. And believe me when I tell you, and Dr. Bess has told you, the multiple things being put in place to improve that. I made the point that systems are so overwhelmed. In the United States, I left New York on Saturday. On Friday afternoon, after the Prime Minister called me and asked me to come immediately, I tried to get a COVID test. I was told that unless I was going for emergency surgery, I could not. I was told that I would need special permission from a hospital administrator. I was told that test results could not be available in 24 hours. And I was told that unless I could show some medical emergency, it would not be possible. And it was not possible in most instances to get tested after 4 o'clock in the evening. So I want to give context, though it does not at all make those who are suffering here feel any better. I'm just attempting to give some level of context to what it is the world is experiencing at this time. Now, the government has indicated that they are working to deal with the issue. Let me also address at this time another matter that has had much resonance on the social media and traditional media. People have raised the fact, or raised as a fact, but it is not, that Barbados government is compensating tourists for a loss of a vacation. But what are Barbadians getting? Let me go back to say that government has given COVID support in the form of adoptive families, in the form of direct cash grants, in the form of support to small businesses, support to the tourism sector, to the tune of $60 million. That is what Barbadians got and are getting. There's an adoptive families program. There's a support program for vulnerable families. But beyond that, this compensation, and I put compensation in inverted commas, is not just for tourists. It is for people who look like me. It is for, as well, it is for Barbadians who came home, like that family, like that man who missed his father's funeral. Yes, if he wants to come back to Barbados, or when he wants to come back to Barbados, he too will be offered a ticket at the government's expense, where that is practical, where he chooses to come. And that is the offer. And I want to break it down. We were facing a situation where, because people were stuck in COVID, and I've given some practical examples, people who paid to have babysitters for a limited time but can't get back, people who are due at work but can't get back, people who came for funerals here but can't get out of quarantine, people who came to see their families, never got to get a hug or kiss or to hold them close, never got into the home to see ma or auntie. So this is for everybody. And how we see it working, we were taking a shellacking. Let's be honest about it. Not only here in Barbados, but in the international media, for the fact that we were saying we were going to deliver test results, COVID test results on the second test in a specified number of days. If you had already prepaid for your Airbnb, If your family was already waiting to receive you and you don't have money for hotel, you are now in a place where you are paid far more than you anticipated to pay. And you're stuck there with no idea as to when you are going to get out. And what government is saying is that for the additional days that beyond when you should have gotten your test result back, if you were stuck for additional days, we will look at compensating you for those days. And here is how we propose to do it. There have been questions about where are we going to get the money from, or where is the government going to get the money from? And this is the approach that is going to be used. If hoteliers are not prepared to comp the stay for those extra days, government will look to see if there are monies owed to us, to government, and write-offs will then have to take place against those costs or expenditures. Lab tests, where necessary, may have to be redone. And there are methods, therefore, which are going to be used to facilitate these additional stays without all cash transactions being done. Visitors may or may not choose to come back. But what government had to determine was whether or not the negative publicity, which we would have had to pay to address, was worth allowing to continue, or whether we should have taken the decision to say, look, yes, we promised you your results in a specific time. You have not gotten those results. You are now put at a financial disadvantage. And if you've had to stay additional time, then we are somehow going to find a way of managing to address that cost. But we do not anticipate that we are going to have to pay out large sums of money. And we took a decision that our international reputation as a high quality, world renowned destination had to be protected. And there was a cost to protecting that reputation, whether we were going to pay to fight litigation, or whether we were going to pay PR firms to be doing aggressive advertising to save our brand and our image. We determined that if we had a gesture of goodwill to those people who suffered inconvenience, that it looked better to hear in the media, government unable to give test results, offering new stay or new vacations than Barbados, horrible destination, results unavailable, lost all my money, couldn't pay hospital bills, couldn't pay hotel bills, etc., etc. And as I said, this isn't just about tourists. There are many Barbadians who are delayed in quarantine in facilities and hotels across the island. In fact, government is putting up some prison officers at Savannah, at Blue Horizon, and at the Hilton Hotel. So the notion that these non-nationals, that tourists are being treated better, are being given more. Everybody who was caught by this, whether Barbadian or non-Barbadian, will be treated in exactly the same way. Perhaps when it was announced, that was not clear. But often when you have a guest and you're serving the meal, you let them take out theirs first. It doesn't mean that they are loved more than the family member. It is the homers that count. And we are therefore going to make sure that those who call Barbados home, those whose navel strings are buried here, those who are facing challenges in this COVID crisis, are going to be dealt with fairly, equitably, and as fast as we possibly can. There is no distinction that makes this administration treat tourists better than we treat our own. But we have a responsibility to those who are our visitors. And let's face it, if these people come back even if we facilitate tickets for them by buying them in bulk or negotiating with airlines or whatever, it means they're coming to spend money in Barbados. It means that a taxi driver is picking them up at the airport. It means that a Bajan is going to braid their hair on the beach, that they're going to buy food in a restaurant. It means that our economy is taking over. And it isn't just about protecting the economy, it is about protecting the society that is dependent on that economy. That is where we are tonight. And with that, I think this is a great point at which I can invite Dr. Corey Ford to make his comments this evening and to answer some questions for me. Dr. Ford, I want to start by thanking you in a very personal way. I have done so to you repeatedly, orally, I've done so in writing. I want to thank you, Dr. Ford. I want to thank you and the team at Harrison Point, all of the doctors, all of the nurses, the ancillary staff, the lab technicians, the x-ray technicians, the people who clean, the people who cook, the people who provide security service for doing an exceptional job in very, very difficult circumstances. I want to thank you for your service to our country, all of you. I want to thank you for allowing Barbados to have this reputation as an excellent COVID care center, excellent and world class. I want to thank you for the way in which all of you have sacrificed and put your country first. Thank you. Thank you from the bottom of my heart at a personal level and on behalf of everybody in this country. I know that people don't know you personally and they don't know the doctors there. They just know that they're doctors and nurses, but I really want to thank all of you. So therefore, Dr. Ford, thank you and welcome so that I can hear you address us this evening.
Good evening to all Barbadians and welcome, Ambassador, back to the beautiful shores of Barbados. Really a pleasure to have you back in the role that you're playing, and much as the CMO has really thank you for joining the team. I too want to join in that chorus in thanking you for assisting us here in this particular context. And I welcome all Barbadians today as I give you an update as to Harrison's Point. And I always start off by saying, and I do again today, would like to thank my staff, all the staff at Harrison's Point, the team, the family at Harrison's Point, who continue to provide the best possible service that we can at the facility with the resources which we have. And our whole aim, of course, is to continue to provide some excellent care towards our patients. And with that, I will give you an update as to what's going on in terms of our isolation facility. So at our isolation facility, as all Barbadians know by now, there's a primary, there's a secondary, and there's a tertiary facility. In the tertiary and the secondary facility, patients are practically all well with mild illness. And on our primary isolation area, which is the one I think of most interest to most Barbadians, I'm going to let you into the facility to give you an idea as to what's going on as of today. So we still have 14 patients within the facility, and we did have some new admissions and some discharges. To be specific, we have currently 6 males and 8 females within the facility area. We have 9 persons who are categorized as currently on oxygen. So that means they need some sort of support in terms of getting oxygen into the lungs. One of these patients is classified for us as severe. This is one of the patients I mentioned to you in the previous news briefing who had improved, but there was a little bit of decline in his improvement. But we believe that there may be improvement back to a moderate state going into tomorrow. The other patients are all on oxygen. And quite interestingly enough, there are 7 Bajans within that number. One of the patients, who's the more severe one, is actually a Barbadian who traveled back from New York. And the others would include 2 British nationals who are still classified as moderate to severe. Interestingly enough, over this period of time, I'm quite happy to say that despite the number sounds the same with the discharges, there are some people who came in to the unit who were quite ill, who were being discharged to the secondary isolation area and are doing quite well, walking around. They were able to go outside, for example. And quite interestingly, one gentleman was there with his fiance. They were able to meet up, and she was quite happy. I had a quite long conversation with them last night. So apart from being in that primary isolation area, we're able to obviously get couples back together. I think that's important. One British couple, and they were quite excited last night to be with each other again. Additionally, in terms of the isolation facilities across the country, at the Black Mongolic area, we've, like I said on our previous call to all the Barbadians, look, there is an area where we have people who are more stable, or people who've certainly been in a facility 6, 7, 8 days, and they're just awaiting that last period to they can go home and reunite with their families or travel out of Barbados. And then in the prison, which I guess most people are interested in, we currently have no patients. I'm happy to say, as I said in the last call, the 17-year-old who was quite ill, but I thought more from asthma as opposed to COVID-19. He's quite well, still remains quite well. He's not in a facility. He's back within his dorm area, and we've had no further admissions. We continue to monitor all of the prisoners on a daily basis in terms of those who are positive, as we're responsible for the isolation facility area. I think there have been, of course, many challenges along the way. For us at the Harsons Point facility, I think that we continue to improve. And as I said on previous calls, look, nothing is ever going to be perfect. But I think the one thing that one needs to do is if there's any criticism, if there's any criticism, as opposed to run away and hide and put your head within the sand, it's important to look at those criticisms to see if they're valid or not. And also to make the relevant changes to try to improve things. And I would, at this point, if permitted by the chair of this meeting, to say to all Barbadians that we thank you. So I think you thank us, but we thank you. And why do we thank you? Because I think the average Barbadian out there understands these particular things I'm going to say now. I think the average Barbadians have come to recognize, we need to be very proud of what we have. We have a very good world-class facility. It's not perfect, and I don't think any place in the globe right now has a perfect facility, but I think we have a great facility, and we have marshaled the troops within this facility to accomplish what we have accomplished within the country. But I also want to say on the other leg, it's important. I think over the last couple of weeks, I've seen something that really has also been encouraging, apart from always encouraging my staff, but I also want to encourage the patients I've been through. And I really want to say this to all Barbadians today. And it is simply this. There are many people who are admitted recently from many genres of life to the facility. Some ill, some not that ill. But one of the things that we've recognized is the average Barbadian on coming to facility has actually reached back to us to try to assist. And this is something I want to continue to encourage Barbadians out there to do, that you have a role to play. It's not my facility. It's not my staff's facility. It's our facility and country. And I think the contributions that have been given by the average patient who've come in, and I just even want to go, if given the authority to just to say this, look, there's been even a 97-year-old lady who donated 1 microwave to the facility, and that 1 microwave makes a difference. So I'm not here to ask for things, but I'm just want you to be aware of that particular aspect, that I think the average Barbadian who's come into the facility has appreciated what they have seen. And if they saw something that they think was a necessity or a need, they have provided that. And that speaks well, I think, for the sort of family nature that there is at the facility. I know there have been challenges, obviously, in the facility with various aspects, and we've looked at it. In terms of our meals, we've looked at that. We have a chef on board, and I will tell you the meals are much nicer. I too eat the meals as well, I would say. And I'll share that with you. And I think there are other things we've done. So I think one of the important things for these patients in isolation is the psychological component. And it's not only the patients or the clients in the facility, it's also our staff as well. It's obviously, and I don't know if the average Barbadian actually understands. If you spent today in my foot or one of the days in the shoes of the staff, then you will see the sort of challenges that they're faced with. And I think they have done quite well in those circumstances. And I will take the opportunity tonight to encourage them and to encourage all Barbadians to continue to support our facilities. It's always easy to criticize aspects. And I'm a very humble fellow. And I'm one who will take criticism and try to wind it to the betterment. And I think that's the way that we have to do things, certainly as a country, as opposed to, to tear people down. Tearing a facility down sometimes brings challenges, not only from the leadership perspective, but on the staff perspective. And I think sometimes we see a lot of, and I'll go on to say, if I'm permitted to continue to speak, but to say, look, sometimes we see things on social media. I'm just going to be very real with you tonight. We see things on social media, and we would know as staff that, this is totally not true. I mean, yesterday there was something going around saying there's no water at Black Mangala. And I'm like, no, that is clearly not true. There's stacks of water. And I even got to the level where I got in my car and I drove and I looked at the water and I said, well, there's the water. So clearly, and I took pictures just to show. So, I mean, despite any differences that you may have out there, I'm not a political person, not into politics. I'm not interested in that. I'm interested in patient care and getting every single Barbadian, every visitor that comes in that facility safely through the facility and out. And despite whatever differences you may have, I really encourage you to rally around the team in the facilities. They work really hard. They communicate with patients the best they can in difficult times. And sometimes it takes, there's some criticism as well, I think, about communication. And we try our best. We've done many, many different strategies to try to improve that. The team on the ground well knows that. But when your numbers increase, then it becomes quite difficult. So we often restructure. And I often say that when we are faced with challenges in situations, it is how we adopt to those situations that make us who we are, certainly as Barbadians. So even the challenges, I'm not speaking on the behalf of the Dr. Best, but to say, whatever challenges that we are faced with, we have to come with strategies to try to, to ameliorate those challenges. And I think that's what makes us the people that we are in country. So I encourage all Barbadians out there not to be proud of what you have, to continue to be supportive of us as we support you. And I really have to say this. I know there's been a lot of talk. And it wasn't asked to me as a question, really, with isolation, but I'm going to take the opportunity to speak about it. And people always ask, hey, what about the new strains? So now today, there's an announcement of a new strain in Japan. But I always tell the RH person this when I speak to them. And I say, look, regardless of whatever strain it is, the mechanisms for you out there in society, internationally, at stopping the spread of the virus is always the same. So it's back to your physical distancing. It's back to wearing your mask as you're supposed to, right? Not only wearing the mask, and you don't wear a mask on your chin, for example, to wear the mask you're supposed to. And of course, the mask of infection prevention control, using appropriate hand hygiene. When you touch those knobs, when you touch your trolleys for the carts, these things are often very, very important. So it doesn't really matter. It's important to know the strain, yeah, but it's probably more important to make sure that you implement those 3 key mechanisms to keep you safe within society from getting COVID. So I think if you focus on those things, it becomes more important. I just want to say the last thing I want to say tonight to you is this, and just to give you an idea, because I don't think the average Barbadian, again, understands the sort of camaraderie and the sort of work and family that we have at Harson's Point. I'll share with you a quick story, if I'm permitted. And I remember very early on in the outbreak, we got a lot of criticism. People thought it was a prison. I always say it's not Ritz-Carlton or it's not Sandy Lane. But one of the key things that happened is that the staff got together and we even spent our own money. Not that the hospital didn't give us, they did. They offered and they provided us stuff as they usually do. But we got together and bought some paint. And the guys will very well remember this. We bought some paint and we said, look, what if we put accent walls? That would change the nature of the room. And I will tell you, I am the doctor and I was painting that room. The nurses helped, the orderlies helped. The only person who didn't help were the kitchen because they were cooking. And I think that speaks well to the fact that we understand that is actually that the facilities we have across country belong to us. And so we have to do the best that we can to make, yes, the guests comfortable, but understand that it might be for us, and we need to make it comfortable as well for us as Barbadians. So I really want to share that story. Nobody asked me to share it. It was really, as I was speaking, it's one of the things that came to my head, that every single person helped. And even the patients who were there when we were painting the room, some jumped in and said, "Hey, can I help? I'm bored." And we allowed them to help to do that. So we understood, I think, the importance of working as a family. And I want you to continue to support us. When we're wrong, you tell us we're wrong, right? When we're good, you tell us we're good, right? But continue to be supportive. And that's really all I have to say. And I really want to thank all of you, and to thank Barbados. You always thank us, but I want to thank you for your assistance. And I really implore you to continue to assist the facilities across the country as we go through this trying time.
Thank you very much, Dr. Ford. We're also extending appreciation to the staff of the Queen Elizabeth Hospital at every category, and the doctors and nurses there in particular. We know that some staff members have tested positive, and that you are working under far more stress. It is in this context, therefore, that I would wish to indicate two decisions that government has made, one of which you are aware because it has to do with the outstanding salaries and hazard pay. As I understand it, Parliament agreed to a supplementary in November of last year that would have, following the negotiations, I think with BAM and with the unions, there was an agreement on hazard allowance and back pay to March of 2020 for specific categories of frontline workers, including the doctors, and a lot has been made about the fact that they have not been paid. When that happens, once the supplementary is approved by the Parliament, there are still multiple tiers of the bureaucracy through which there is a pipeline through which it has to go. And unfortunately, that pipeline takes a while. It is not an immediate process. That pipeline also suffered from a jam called Christmas and New Year's, where people are on holiday. There were several public holidays, and then we had an additional 2 this year. So the processing through the many tiers of government, through the many departments, took much longer than was anticipated. However, full approvals were given last week, and the monies were sent to QEH. So there are $14 million, including $3 million in hazard pay, has been approved, is unreleased, because it was approved at Parliament, has gone through the various stages. It has now been released and given to the Queen Elizabeth Hospital. So Dr. Ford, Dr. Best, for those doctors and who had money stuck, salaries stuck, back pay and hazard pay on which they were waiting, and other categories of staff. And I have the data here because the public may be interested in knowing. I think that there was a daily rate which ranged from $60 to $20, depending on the categories of staff, and it's all broken down what the hazard pay, which is an ex gratia payment for various categories of staff. So I know that this has been a deeply distressing delay for you, and it is not a policy failure, but system malfunctions or system challenges, which we are fighting in every instance, and we're also doing our utmost to correct them. Our government is doing its utmost. I would indicate that another point of delay has been in the numerous calls coming into the call center, which have gone from the average norm of 7,000 to 31,000. That gives you some idea on the kind of volume and how difficult it is to manage that. In that regard, a decision has been made to open even more call centers, and that will happen over the course of the next 48 hours or so, and they will be staffed in order to get these to service the large number of calls, the large volume of calls that we are now experiencing. Equally, Dr. Ford, I am sure, because we have discussed this and I know how important this is to you, a decision has been made that doctors at Harrison Point, frontline workers at Harrison Point, who are having severe challenges from dealing with patients, dealing with the situation, the stress of working on the front lines with a disease like this, will be entitled to psychological or psychiatric support or counseling support if they want it and if they feel they need it, that this will be offered by government to help to equip them to do their job well and to allow them to function optimally while they are on the front line. So just to tell you that of those two decisions, the $14 million that has been released for back pay and to March of 2020, and for hazard pay that is now with the QEH, which will be in people's accounts or in the checks in their hands during the course of the next couple days. Let me also make a correction. I said earlier that prison officers were at Blue Savannah and Horizon. Barbadians whom government is supporting are at Blue Horizon and Savannah, where we've had overflow. Barbadians are being allowed to go there, but prison officers are at Hilton and Sun Bay hotels. I'm going to move then with these corrections and this further information. I'm going to ask now the Honorable Sandra Bradshaw, Minister of Education. This is an issue which impacted the opening of the new school term. Minister Bradshaw, can you please bring us up to date on matters relating to school and what is going to happen, whether the students will have all the equipment they need, what is being required or what is being done relative to the opening of the new term?
Thank you, Ambassador Thompson. I think like all others who've spoken before me, I really want to say sincere thanks to you for joining the team. Just this morning, we had been having a meeting and this afternoon, and I know it's like the old Bajan saying, as soon as you land, you come shore. And we're really grateful to have you as part of this team to be able to communicate to the Barbadian public and to answer a lot of the questions that they have. Now, in relation to school, I think it's fair to say that at the end of last semester, the last time I spoke, certainly, it was to enlighten the country that we were planning to go back to school in the physical plant in a gradual way. Regrettably, because of the upsurge in cases, obviously we had to, like everybody else, we had to make those adjustments to the plans that we had for the second term. The last few weeks we have spent, since the Prime Minister would have made her announcement that schools were not going to go back into the physical form until after the 14th, a decision would obviously be made. We have been spending a lot of time in the Ministry of Education relooking the plans for reopening of school, whether in a full format or obviously in this case in a virtual format. And of course we've leaned towards the virtual format going into a situation of online classes at this point in time, simply because we recognize that from the Ministry of Health's perspective, it's important that we take time to make sure that the country gets a handle on these cases. One of the things that I think all of us have recognized in education is that whether it's our children, whether it's the teachers, whether it's persons within the Ministry of Education, there has been an impact on a number of our stakeholders. And as a consequence, these last 2 weeks have really given us some time to appreciate the impact and how wide the impact is. You have persons who were prison officers who are married to teachers. You have persons who work within the Ministry of Education that may be connected to somebody on the West Coast. You have persons who've been impacted who have children as well. So we have taken this time to really just rethink and to pause and really kind of go on a reset button to recognize that we have to reassess the number of devices that students had access to. I think you could appreciate as well that over the last term, as we were getting ready to go back to the classroom environment, a number of students may not have come forward for devices simply because they were doing a lot of face-to-face classes. So we had to get all of the data in place to determine whether or not students still needed devices, and we've compiled the majority of that data. We've estimated that we have about between 4,000, 5,000 kids who may still not have access to a device, or in some cases not have electricity or connectivity at their respective homes. And the government has made a decision to, in the interim period, to be able to proceed to purchase those devices on behalf of those students, so that we can ensure that we can start school on the 18th of this month in an online platform. Now, there are students who would have received devices. We had over 8,680 students who received devices. The total request at the time was around 9,000. We therefore were very close to our target, and of course COVID came, so we're now obviously having to purchase devices to be able to make sure that these kids are able to get online. I would have updated the country previously that we had entered into discussions with the Kenyan government with respect to obtaining over 21,000 devices from them. And just as has been said by everyone else on this call tonight, there are some challenges that you often experience in government. And one of those challenges is that when two governments in particular are negotiating, there's always a back and forth in terms of the contractual arrangements. And this Kenyan the devices program has been no different, and we've had obviously periods where they have had some challenges on their end in terms of their cases, and equally we've had some challenges on our end as well. So while we intend to still pursue aggressively the plans for completing that arrangement that we have started with Kenya, we believe that there's an urgent need now to be able to allow our students who are without devices at this point in time to make that transition into the online environment. Now, over the last week or so, I really want to say thank you to our teachers, to our principals, to the unions as well, because in every situation that I have called on the stakeholders to engage with the various ministry officials to discuss whether it is guidelines, protocols, their position in relation to the new start date for the term, they have been receptive. They have engaged with us. They've shared their ideas. And, you know, one of the things that we have recognized in this entire process is that people are really dealing with different levels of stress as well. And our teachers are no different. Our principals are no different. Certainly persons in the Ministry of Education is no different for them as well. I can tell you that we feel sometimes in the cabinet subcommittee like we are part of a roller coaster. 1 minute the news is good, next minute there are challenges, and we've had to adapt from the level of government, but we've also had to adapt in the Ministry of Education. And I just want to really say thank you to the entire public, because the Barbadians I know wanted to hear something like a few days ago, and we felt that we had to take a pause and really gather all of the information so that we could come to the country with something concrete to be able to say as it relates to your child's education. So effective from the 18th of this month, we intend to basically return to an online platform. We've spent the last few days making sure that our teachers have been retrained and retooled. And believe it or not, it is an ongoing process. It is nothing that you can learn within a matter of a couple of days. But fortunately, we have the Urdistan Teachers Training College that has been working very closely with the ministry, and also our partners through the IDB, and also some universities in Finland that have been working with us to ensure that in the classroom that our teachers feel a bit more comfortable being able to use technology to enhance what they're doing in the learning environment. So we know that there are challenges. We know that perhaps as we start the online classes on Monday, that there may still be some challenges. There may be some teething issues. We've become accustomed to dealing with the issues as they present themselves. But we are also mindful that there are a lot of social, emotional and psychological issues that persons are encountering at this point in time. And we therefore can't just rush straight into online classes without, as I said before, taking a pause during this period to be able to ensure that we put all of the necessary systems in place. So in the course of the next few days, you will start to see some PSAs speaking to parents directly about getting students prepared for the classroom. You will also hear some PSAs in relation to our students, because we want students to take this online platform seriously. Quite apart from having the device, it is also about making sure that parents and students recognize that this is actually a learning platform. And while it may be different, while it may be difficult at times, the internet drops out, there's the issues of connectivity. that we want them to give 100% in the online environment. None of us expected that we would be in this situation today, but one of the things that we have been able to do is to adapt quickly. So I can give you the assurance that we are working behind the scenes very, very, very hard, very long hours. We're working to ensure that no child is left behind, that we deal with the emotional support that is needed for our students and certainly for our teachers as well, because without them, there's going to be no learning experience for our children. We've also looked at our special needs children because more than anything, they are obviously, it's been very difficult for them to cope in this environment, and even more difficult, obviously, having to transition to the online platform as well. So we're working closely with the entire team to make sure that we can put together PSAs that will help to alleviate some of the anxiety that all of us are feeling, and in particular persons in the educational system, and make it easier for us to make that transition to the online platform. It is my hope that we can get our cases under control. I know the Ministry of Health officials, the entire team is working really hard. Yeah, we've had some challenges, but for the most part, I still feel that Barbados is doing relatively well. And I hope that we can get back to a point where even if we have to start with the blended approach again and then move and to transition into the face-to-face environment, I am comfortable that we will be able to work with the Ministry of Health officials to be able to get our students back into the classroom in a shorter time frame as humanly possible. But as it is right now, let us just appreciate that this government is trying. The Ministry of Education is working to make sure that you can make the transition to online. And there will be some other PSAs that will come out as well if there are students that we have missed, because in all of these things, sometimes you miss a student and someone who has a genuine need. That is to be expected. And just we ask parents to update their contact information, because over the course of the next few weeks, PTA meetings are going to have to be virtual. Form meetings are going to have to be virtual. You're going to have to equip yourselves quickly, whether it is watching YouTube videos or speaking with the ITCs at the school, to get an understanding of what your students and your children are doing in the classroom environment online. We need as much support for our children. And therefore, regardless of them being in the home environment and doing online classes, we want you as parents to treat this in a serious manner, and also our students to treat to this issue very seriously as well. We will work together to make sure that we make this transition as seamless as possible. But at this point, our decision is really to move forward. And I think we have the support of the majority of the stakeholders, if not all of the stakeholders rather, because we've been consulting, we've been working on policy guidelines. And I think for the most part, there is consensus that we need to make the transition, but we have to obviously iron out some of those pressing issues in relation to access to devices and connectivity. And we're working on that. Thank you, Ambassador Thompson.
Thank you, Minister Bradshaw. Thank you for making the situation in education and with the students in this situation clear. We are moving toward the end of this press briefing. I just want to make two observations, please. First of all, to make the call center numbers clear, that we normally have on average 1,700 and we are now at 31,000. So that does give you a very clear idea, and we have stepped up to address that. The second thing I want to make clear is that while it has been all over social media that doctors are not being paid, they receive their salaries on time, they receive their on-call and other allowances on time. What has been outstanding is the issue of the hazard pay, which goes back, was agreed and negotiated that it would be paid effective from March of 2020. So that hazard pay is now, was part of a vote that went to the QEH to deal with COVID and a range of other issues. And the hazard pay itself is the sum of $3 million. So all of the money voted for hazard pay is now with the QEH and will be given to the doctors who had not had it, and on whose behalf it had been negotiated. So that is just to be absolutely clear that ordinary salaries were not outstanding, but the hazard pay, the negotiated hazard pay was, and I explained the delay and why. Now, let me say thank you for joining us this evening. This evening's press conference took much longer than I'd anticipated because there were so many things in the public domain and in social media that I wanted to clarify for you, and things that we needed to address and make clear. Going forward from tomorrow, when the press is with us, we are going to be tighter and cleaner and far more focused, dealing with less with responding to what is there, but we felt that we needed to allay the country's concerns. I'm still getting fully briefed and up to speed, because please appreciate that. Today was my first day on the job, and I was in briefing meetings back to back. So I'm still trying to absorb all of the information and come to grips with all of these issues. But I will be fully equipped to deal with the media tomorrow, the press tomorrow, and to answer questions more succinctly. And we can promise you an earlier, tighter, more focused press conference. But we did want to really treat to some of the concerns that people had expressed on social media in the calling programs, and to give you full and frank answers. And I want to thank you for joining me this evening. I apologize that the lighting is such that I have to be in the corridor in order to be seen, but tomorrow I'll try to improve that. Thank you so much for joining us. Good evening, Barbados.